Hello, good day, Mrs. Mary Grace Obdulia O. Amok, RN. My name is Joshua Go from Bachelor of Science in Nursing, SN3. So I am here going to demonstrate the colostomy care. So what is colostomy care? It is a surgical procedure which brings one of the large intestine or which brings one of our large intestine through the abdominal wall. No, so during this procedure, one in the end of the colon is diverted through an incision in our abdominal wall to create a stoma. So this stoma is opening of the skin where a pouch is collecting feces is attached, when a person can defecate in that pouch because he has no opening, maybe it's no opening in the anus or there's a problem in the intestine. So what is the purposes of this procedure? The number one is it is to maintain the integrity of the stoma and peristomal skin. Also, it prevents lesions, ulceration, and other skin breakdown caused by fecal contaminants. And then also, it prevents infection, promotes general comfort, and promotes positive self-concept. So, the materials that are needed in the procedure are, you need a disposable gloves, you also need some bedpan if you do procedure for the client to defecate if lying in the bed, and then basin of warm water, and you also have some mild soap for the washing of the peristomal skin, washcloth, and you also need some towel to avoid patient from being wet, air freshener, this is optional to spray for the room, with new pouch appliances for the colostomy, cotton balls or cottons, scissors, pen or pencils, peristomal skin paste or powder with special adhesive, no safety razor. You also need some tail closure clamp, okay, now which is in the, and then some tissue or gauze pad and a mirror. So, as a nurse, we are following the basic guidelines of the nursing process, which are the assessment, planning, implementation, evaluation, and you document. Okay? So, number one, for the procedure, first procedures, you're going for your assessment as a nurse. You're going to assess for, check for the physician's order for the stomach care, and then inspect the appearance of the stoma. It should be like, make sure that it is pink, moist, very pale, or, dark, and colored stomas with a bluish or purple hue, which indicate the impaired blood circulation to the area. And then also you're going to assess for the characteristics of a fecal waste, like the amount, the type of the feces, okay, the color, the odor, consistency. There's also for inspect for abnormalities such as any pus or a blood in the stool or the feces. And then also make sure that the feces is fullness. Pouches need to be emptied by 1/3 or 1/2, not full, because it may spill out or spread out in the patient's bed if the patient is lying down. And then identify the complaints of the burning sensation under the faceplate which indicate the skin breakdown. Okay, and then abdominal discomfort and or distension also needed to be determined. Also determine the need for an appliances to change. And then assess for client's emotional status, especially when used to cope with the patient is using ostomy or the strategies that he or she is using. And then for your planning, you're going to plan carefully for the procedure. Make sure to achieve the following: peristomal skin integrity will remain intact, no redness, and then also edema, swelling, tears or breakdowns, ulceration, or fistulas appears in the stomach. Make sure there's no that one. And then client or caregiver will demonstrate the skill of performing the irrigation of the colostomy. And then client, make sure that the client will express positive feelings about themselves having a stoma. And then client will maintain fluid balance, and you gather the equipments to help save time, effort, and energy. For the procedure proper or the implementation, how to do it, the first thing you're going to do is explain to the client what you are going to do, why it is necessary, and how he or she can cooperate. Okay, then you can wash your hands now, apply clean gloves, and observe appropriate infection control procedures. And then make sure also that you after you have put the gloves on your hands, provide Assist the client into a comfortable sitting or lying position in bed, okay, and probably sitting or standing position to the bathroom. If the client is do it for yourself, position a mirror. Then if the client is wearing belt, you fasten the belt if the client is wearing one. And then if the client has many hair, shave the peristomal skin of a well-established ostomies as needed. Okay, that's why you have for the razor. And then after that, you have to make sure that the colostomy is empty and remove the ostomy appliances. Empty the contents of the pouch through the bottom opening into the bedpan. You put it on the bedpan after you have opened it. Okay. And then assess the consistency and the amount of effluent. Peel the bag off slowly while holding the client's skin taut. Okay, make sure that carefully remove it, no, so the patient can avoid any infection. And then after that, you can now wash your hands and re-glove for another procedure. Okay, and then assist now the client in dry peristomal skin and stoma. Now use the toilet tissue to remove excess stool after you have re-glove. Okay, use a warm water and mild soap. The mild soap is optional. Okay, and cotton balls or washcloth, you can use washcloth to clean the skin and the stoma. Then make sure you use a special skin cleanser to remove dried or hard stools by dry the area, or also after you remove that one, make sure to dry the area thoroughly by patting the towel or a cotton balls into the client's peristoma or the stoma. Then assist now the stoma and peristomal skin. Okay, make sure to inspect the stoma for color, size, shape, or any bleeding. Inspect the peristomal skin for redness, ulcer, or irritation, ulcerness, irritation. Okay, and then you remove the excess dirt, or if after you have cleansed it. Now place a piece of gauze and pad over the client's stoma, and then apply some paste type skin barrier if needed or necessary. Now make sure also make sure to resize the shape of the stoma by cutting it, no, as after you have done, and then remove that one now for you to apply. Remove the tissue around the stoma before applying the pouch. Prepared and apply clean appliances. Center the opening of the pouch over the client's stoma and apply it directly into the skin barrier. Gently press the adhesive backing onto the skin and smooth out any wrinkles working from the stoma outward. Remove the air from the pouch. Place a deodorant on the pouch. Optional. This is optional only. No? And then you can close the pouch by turning up and the bottom a few times, fan holding it and lengthwise, and securing it with the tail clamp closure, which is placed in the bag. Then remove the gloves and restore or discard all equipment appropriately. Wash your hands. Air freshener also is applied. And for your evaluation, make sure to evaluate the client's tolerance and reaction to the procedure. And then regularly you have to assess for the ensure that the peristomal and skin integrity remains intact. And then client or the caregiver is also able to demonstrate performing irrigation of the colostomy. Client will express positive feelings about self, and client maintains fluid balance. And make sure to document or record for the evidence of the following. Okay, the color, the consistency, the amount of the feces of the pouch, condition of the stoma, peristomal skin, abdominal assessment, client's experience with the ostomy, and skills learned by the client. You can check this in the client's chart or document record. That will be all. Thank you and God bless.